Hello, YouTube. Welcome to my channel. Are you a Black woman seeking to have a medical procedure or treatment abroad? Well, this channel focuses on medical tourism for Black women. If you're interested in learning more about cost, pre and post surgical treatment, medications, therapy and follow-up, and more, make sure you subscribe to my channel and hit the notification bell so you are notified when I post a video. So my name is Dr. Natasha Ramantal, also known as the Medical Tourism RN. I am not a physician. I'm a doctoral trained registered nurse who's worked in the emergency department and post anesthesia care unit for a number of years. So on my channel, I cover all aspects of medical tourism for Black women if they decide to seek healthcare or treatment abroad for things like cosmetic surgery, cancer, fertility treatments, anything that you can think of. But I want to make sure that Black women make the most informed decisions about their health care to have the best outcomes and experience. So February, and I realize that we are literally at the end of it, but February is American Heart Month. And in the spirit of things like Valentine's Day, etc., that's the red, that's why I have it on. But I thought I would take the opportunity to discuss heart health. So I'm going to share with you what Black women need to know about heart health. And for a bonus, be sure to stick around because at the end of the video, I will share the 6 best countries for heart surgery. So you don't want to miss it. Okay, so heart surgery may remain one of the top leading causes of death in the US for a number of years. And this is actually followed by cancer and since 2020, COVID-19, believe it or not. But Black women have a 50% higher risk of heart failure compared with white women. And Black men have a 70% higher risk of heart failure compared with white men. But Black adults are actually more than twice as likely as white adults to be hospitalized for heart failure. So, what exactly is heart disease? So, in the medical community, cardiovascular disease, or CVD, that's also heart disease, is actually a group of disorders that can affect any human being at some point in their life due to various reasons like an unhealthy diet, obesity, sedentary lifestyle, family history. Of a heart condition, a high level of stress, and also use of tobacco, drinking too much alcohol, diabetes, high cholesterol, pregnancy, even, and also birth control and hormonal changes that take place surrounding your menopausal years. That can also increase a woman's risk for heart disease. In fact, women using a combination of, say, birth control and smoking can actually boost a woman's chances of heart disease by 20%. So, heart disease is one of the leading causes of mortality in the world. Almost 18 million people suffer from heart disease, and blood pressure, cholesterol, and stress management are all things that you should be monitoring in order to lower your chances of being affected by heart disease. Although some of the treatment for heart disease includes things like medications, diet restrictions, following a healthy lifestyle, making sure you get exercise and take care of your diet, many of the heart diseases require surgical treatment. So, as heart disease can be of various causes, it is actually difficult to manage some of the causes only with medications. And this is where surgery comes in. It remains the major option. So, all around the world, heart surgeries remain the choice of treatment for heart disease. And there are things like coronary angioplasty, stent placement, heart bypass surgery, and heart valve surgery. All of those things, if you're not familiar with heart disease, may sound a little scary or it just sound like a lot of medical terminology. I'll explain some of it as we go through the video. But the key is early detection with the appropriate management therapy, and that can actually reduce the cost of treatment and also prevent further complications, severe complications. So, depending on the type of heart disease, the treatment and the surgery can be changed, which can cost you a fortune and leave you an effect on your financial as well as your mental state. So if you're in a clinical state of surgery where, this is the only way it's going to assist you with your heart disease, the major task can be the selection of an appropriate hospital or also an appropriate surgeon, cardiothoracic surgeon, in order to conduct your surgery. And then, of course, you're looking at cost and how that plays into the right treatment. Before I get into the countries that actually are the best for heart surgery, I just want to give you a little bit of information on symptoms of heart disease, particularly of heart attacks for women, because they differ a bit for women than they do in men. Chest pain or shortness of breath still remains a common thing that happens in both men and women. But with women, we see a little bit more of the pain that's in either one or both of your arms, pain in your neck, your jaw, shoulder, upper back, or even the upper part of your abdomen. You'll have discomfort, and some people pass it off as, oh, I think I just have heartburn, when in actuality, it may be something a bit more serious. Also, you may have uncomfortable pressure in the chest that lasts for more than a few minutes, and it can go away and come back. The shortness of breath with or without the chest pains, as I mentioned, nausea or vomiting. And sometimes you can have nausea and not experience the vomiting, and that may be something as well. And then breaking out in a cold sweat and lightheadedness or dizziness, unusual fatigue. And I know that's a bit different for women because a lot of times you're stressed, you take care of so many things in the home or take care of others, whether it's children, parents, or some other loved one, and work, that you may think, oh, I'm just tired from all of these things. This is unusual fatigue, even more than what you felt normally. And then heartburn, actual indigestion. If you find that you have that consistently where you did not have that before, these can be signs of a heart attack in women. Um, One of the things I wanted to share with you is high blood pressure. Although it is not heart disease, it can be a contributing factor, a major contributing factor, actually, which is why high blood pressure is not something that you want to ignore. High rates of high blood pressure for Black women in particular is astronomical. 2 in 5 Black women, or 43%, actually suffer from hypertension compared to 27% of white women. But Blacks also have a disproportionate burden of diabetes. So Black adults in the US are 60% more likely than white adults to be diagnosed with diabetes. And a study actually revealed that non Hispanic Blacks were found to be twice as likely as non Hispanic whites to die from diabetes. So be sure to pay attention to the signs I've mentioned. And if you happen to have high blood pressure or diabetes, that you have it under control. And if you have any of those symptoms, please act on them. Okay, so as I promised, I'm going to share the 6 best countries where you can go for heart surgery at a much lower cost than in the US, where you will also receive excellent patient care. These countries all have innovative technologies, expert teams of surgeons, and it's at a cost that you can bear. Okay, so if you are healthy enough to travel for heart surgery, before you travel, be sure that you factored in the time needed post surgery for recovery and also for follow up time in country if it's needed. It's critical that you do not fly too quickly after heart surgery, and I want you to be as safe as possible. Okay, so in no particular order, the first country that one of the countries that's best for cardiac surgeries or heart surgeries is India. So India is actually a cardiac hub for surgery. And in the British Medical Journal, they reported that doctors actually perform around 60,000 open heart surgeries yearly in India. Another study stated that India has seen remarkable changes in cardiac surgery during the last 20 years. They are doing heart transplants more frequently. They actually have a heart transplantation program, and it's number one in South Asia. They do 12,000 coronary angioplasties, and that's a procedure that's just used to open clogged heart arteries. And then 25,000 or more coronary artery bypass grafts, or what the medical community calls CABG. That's where surgeons perform this type of surgery where it bypasses blockages in your coronary arteries. Okay, it's a procedure that's done fairly widely in the United States. But India has a variety of institutional hospitals and research centers to treat your clinical condition with a well trained team. They also provide a gold standard of 98% success rate with a vast range of cardiac surgeons available with affordable rates depending on your budget and your choice. They have a standardized protocol for hospitals and a national accreditation board for hospitals and healthcare providers in order to govern their quality of treatment that's provided to their patients. So they monitor that very well. Also, they have world class technology, which is tailored according to the need and affordability of the patient, and a cost which is 80% less when compared to other countries like the US and the UK. So the cost for open heart surgery in India ranges from 2,000 US dollars to 35,000 US dollars. And a bypass, that cabbage I mentioned, that surgery costs around 2,200 to 5,500 US dollars, which is far less than other countries where it actually ranges from 5,500 to 12,500 US dollars. Okay, so a lot of savings there. But many of the top clinics in India have international accreditation and partnerships with Western hospitals. And another advantage that India has over other countries is that they listed as the number. This country actually has the largest English speaking medical professionals outside of the US. Okay, so you'll have no trouble finding an English speaking surgeon. Something to consider with India is actually the distance and the procedure you're going for, and whether you will need follow up, in factoring that into your cost of travel and how long you plan on staying. All right, number two, Turkey. So, Turkey actually stands as the highest success rate for heart surgeries and heart disease treatment. But now, in light of the recent earthquake in Turkey, it depends on where you're going for surgery. So, it's my understanding that the capital, Ankara, and the city of Istanbul, which is pretty popular, were not directly affected by the earthquake. And they're great cities to go and have your heart surgery in. But Turkey is equipped with a highly experienced and qualified healthcare team, well versed in with updated treatment plans and the latest cardiac procedures. They also offer invasive and non-invasive methods depending on your clinical condition and your need for treating your heart condition. So when compared to the US, UK, Australia, Turkey actually has the lowest cost for performing a bypass, the cabbage surgery, with all the expert opinions and a better healthcare plan. An angioplasty in Turkey can cost about 1,500 US dollars to 2,400 US dollars. And this includes 1 day of hospital admission, which is lower when compared to other countries. But Turkey also offers robotic heart surgery, which robotic heart surgery includes, like, it's more precise. So there's accuracy, precision, and a little more expertise when they use that particular type of procedure. The country also offers hospitality. There's zero waiting time. And there are also government schemes for professionals, meaning Turkey has universal public health insurance. So all residents that are registered with the Social Security Institution there, or SSI, they're entitled to free healthcare. Also, various research centers and government funded projects provide Turkey with research on improving and developing new surgical procedures. Number three, Dubai. So, Dubai is actually seen as the heart hub or heart surgery hub because their standards are very, very high. So, there's a Dubai Healthcare City, DHCC, and that's a healthcare free economic zone. So, it's basically a designated area in which companies or hospitals are taxed very lightly or not at all in order to encourage economic activity. So Dubai has this plan where they essentially put all medical facilities in this one city. So it's situated in Dubai, but excuse me, the DHCC was launched in 2002, and it was mandated by the government in order to meet the demand for high quality, patient centered healthcare. And the main aim is to attract tourists to Dubai for medical services and treatments. So, Dubai has world class treatment facilities, and they also perform a number of non invasive surgeries and medical procedures, as well as invasive surgeries. Dubai is also a hub for all world class hospital branches with a team of experienced cardiac surgeons. So, Dubai consists of various hospitals that are staffed with experts from around the world to manage and conduct heart surgeries without complications. So, those world class experts with experience, they also do robotic surgeries, like I mentioned, and they do non invasive methods such as what's called a whole bypass surgery, which is pretty cutting edge. But it basically, the aim is to bypass blocks in more than one of the heart's arteries, and they do it through a small cut between the ribs on the left side of the chest rather than typically going through a large cut in the middle of your chest. So very cutting edge in terms of innovation and technology. They do have a standardized protocol for monitoring the quality of patient care for hospitals, and Dubai also offers minimally invasive surgical procedures that are performed with that smaller incision, which the smaller incisions actually reduce pain, it lowers the chance of infections and bleeding, and it provides quick recovery and a shorter hospital stay. So that's all really positive. And Dubai consists of the top ranked hospital in the world for conducting heart surgery. Number four, Thailand. This should be no surprise, but Thailand is experienced and qualified. They have qualified healthcare professionals. They're known for all medical tourism, but Thailand is one of the locations that's preferred by foreigners for having heart surgery, and this is due to an improved medical system and cardiac surgeons with vast experience. Also for price. So Thailand offers low-cost surgical plans, which range from 7,800 US dollars to 14,700 US dollars when it's compared to the US and the UK prices for the same thing. Um, Thailand recently introduced this procedure called an off pump coronary artery bypass grafting, so an off pump CABG, which is one of the demanding procedures which is not available in any other Southeast Asian country. An off pump cabbage is basically a cabbage that is performed without the use of a heart lung machine. So, this means the heart continues to provide blood to the rest of the body during the surgery. So, it's sometimes referred to as a beating heart surgery, but in the other method, with traditional method, what's used in the surgery is a machine takes over the functions of the heart and lungs, and the heart is still. So this is really innovative. It's something that Thailand's been doing for quite some time. Also, Thailand sees more tourists than any other country in Southeast Asia, and they're actually ranked as number three as being the most popular country in the world for medical treatment. Their cost savings can be anywhere from 50 to 75% when you compare it with the US prices. And Thailand hospitals are accredited with the Joint Commission International, which provides the utmost quality of treatment. So the Joint Commission is actually a US based nonprofit organization that accredits more than 22,000 US healthcare organizations and programs. But they have an international branch, the Joint Commission International, and that branch accredits and certifies healthcare organizations, programs, and medical services from around the world for healthcare and quality of care and patient safety. Okay. Number five, Spain. So Spain is Spain's health system comes under the regulations of the EU, the European Union, which maintains the quality of treatment and procedures. And recent studies have actually shown that during the period from 2015 to 2019, Spain treated a considerable number of patients with heart pain and patients with heart failure, and the medication costs were really low when compared to other countries. The surgeries in Spain include a cost which is less than in the US, a basic range of 27,000 US dollars, which I know sounds high, but honestly, when you're talking about heart surgeries, it depends on which ones. That 27,000 US dollars is required for 5 days stay, hospital stay in Spain to have the heart surgery. However, the cost increases to more than double that, to 56,000 US dollars for the same care in the US. Okay, so it more than doubles in the US. So you have a significant savings there. But Spain offers the same Joint Commission International accreditation as other top hospitals around the world. Spain has a total of 750 hospitals, so you have a lot to choose from. And Spain can actually yield big savings of up to anywhere from 30 to 70% on surgical procedures done for heart disease. Okay. And last but not least, number six is Cuba. And that might be a surprise to some, but Cuba has actually achieved a surgery survival rate of over 95%. And this is including coronary and vascular operations and those linked to congenital heart defects. That 95 over 95% survival rate places that island among the most advanced countries in this field. And in 1986, they opened a children's heart center. It was established at a pediatric hospital in the capital, Havana. And the work of the center since then has concentrated on things like diagnosis and surgical treatment of congenital heart diseases, with an emphasis on the most vulnerable, which are newborns, infants under 1 year of age, and complex heart diseases. So that is because congenital heart diseases or congenital heart defects is an abnormality in the heart that actually develops usually before birth. And congenital heart defect is one of the most common types of birth defects that's not always detected at birth. So there's a lot of headway that was made, particularly with pediatric population of health of heart issues in Cuba. But Cuba is very close to the US and it's very inexpensive to travel there. Cuba is open to travel for Americans, and it's generally safe to travel to Cuba. There are multiple ways Americans can travel to Cuba. You can visit Cuba in a completely legal way with your valid US passport. I would just say make sure that your passport is valid for the entire length of stay, or it can create some problems. Also, the Cuban government requires travelers from most countries, including the US, to have a Cuban tourist card. Sometimes they call it a visa, but they call it a Cuban tourist card. In order to enter the country. So it's easy to obtain one in advance online or through your airline itself. And usually that can be done at the airport, very convenient. And you can also do what many Americans do. If you don't want to do it that way, you can simply book a flight from another country like Mexico or Jamaica. It's very easy to land there and get through as well. Keep in mind, though, with Cuba, um, so US credit and debit cards do not work in Cuba. So if you're going for surgery, you need to ensure that you have discussed how the hospital is to be paid in advance. More than likely, it'll be cash. So you're going to want to make sure all of that's in place before you travel, so you don't have any issue. And then take additional cash with you for the entire remainder of the trip, since you won't have access to credit or debit cards on the island. All right, so that wraps it up. As always, I encourage you to do your research, check the accreditations of the hospitals that you're considering, as well as the credentials of the surgeons. Many sites post reviews from patients, and you should read them. Also, expat and repat sites and travel sites usually have a Q&A page. Post your questions, and people will share their experiences with you. But until next time, be well, and do not forget to subscribe and click the notification bell so you know when I post the next video. Thank you.